Understanding the body's most subtle signals is the key to mastering long-term vitality, especially regarding the kidneys. Many people only react to health crises, ignoring the quiet whispers of imbalance until they become loud shouts of disease. Yet, a framework exists for interpreting these early signals, allowing for proactive adjustments that preserve deep health long before an emergency occurs. This exploration adopts the perspective of Heng, emphasizing that true longevity is not about avoiding failure, but about cultivating a deep, observational awareness of the body's interconnected systems. The kidneys, in this view, are not just filters, but foundational pillars of daily energy and resilience. The silent role of kidneys in vitality: the kidneys operate in relative silence, yet they are masters of the body's internal balance. Most people associate them purely with waste removal, but their function is profoundly more complex and essential for vitality. They are sophisticated chemical processing plants that manage fluid levels, electrolyte balance, and blood pressure. This silent work is continuous, adapting every minute to what the body ingests, the stress it endures, and the demands of its environment. Without this constant regulation, the internal environment would quickly descend into chaos. This regulatory role extends far beyond simple filtering. The kidneys produce critical hormones that influence other bodily systems. They release erythropoietin, which signals the bone marrow to create red blood cells, directly impacting energy levels and preventing anemia. They also produce renin, which controls the constriction and relaxation of blood vessels, thereby managing blood pressure. Furthermore, they activate vitamin D, which is essential for bone health and immune function. The kidneys are, in essence, a critical hub for systemic communication and maintenance. From a holistic standpoint, such as the one emphasized by Heng, the kidneys are viewed as a root system for the body's energy. When this root system is strong, the individual experiences robust vitality, resilience, and clarity. When it weakens, the entire system suffers, often in ways that seem disconnected from the kidneys themselves. This weakening is rarely sudden. It is a gradual decline, a slow dimming of metabolic fire that often goes unnoticed in the noise of modern life. A common scenario involves an individual in their late 50s or early 60s who feels a pervasive, nonspecific fatigue. They struggle to wake up in the morning and experience an energy slump in the afternoon, attributing it to age or poor sleep. Their doctor may check basic metrics, but if kidney function is only mildly impaired, it may fall within a normal range that masks a downward trend. The individual may continue for years, accepting this diminished vitality as inevitable, never realizing it is a quiet plea from their overworked renal system. The primary limitation in recognizing early kidney issues is this very silence. The kidneys are highly resilient and can continue to function even when significantly compromised. An individual can lose a substantial amount of kidney function before overt symptoms or standard blood tests raise an alarm. This resilience, while remarkable, means that by the time symptoms do appear, the underlying issue may already be advanced. Fatigue, for instance, is easily blamed on stress, work, or aging, rather than the kidney's reduced ability to produce the hormones that sustain energy. The mechanism of this decline often involves a slow, progressive hardening and narrowing of the small blood vessels within the kidneys. This process, often accelerated by high blood pressure or high blood sugar, reduces the kidney's ability to filter blood effectively. As the filtration rate drops, the kidneys must work harder to clear waste, placing them under further strain. This creates a feedback loop where the damage slowly accelerates, all while the person remains unaware of the internal struggle. Recognizing these connections early is a valuable step for anyone seeking sustained well-being. This perspective shifts the focus from treating disease to cultivating awareness. Heng's approach emphasizes listening to the body's subtlest cues. It involves noticing small changes in energy, stamina, or recovery that others might dismiss. It requires an understanding that the body is a single, integrated system, The fatigue felt in the mind and muscles may originate in the silent, dutiful work of the kidneys. This lack of obvious symptoms presents a significant counterpoint to the body's louder systems. A broken bone demands immediate attention. A lung infection makes breathing difficult. The kidneys, however, soldier on. They do not typically cause pain unless there is an infection, a stone, or a very advanced disease. This quiet nature means a proactive, rather than reactive, approach is necessary. But this silent work means that when they do send signals, they are often mistaken for something else like simple aging or stress. The true challenge is learning to interpret the whispers before they must become screams. What am I still allowing that costs me peace? Subtle shifts in energy and hydration, the earliest indications of compromised kidney function, are often deeply embedded in daily patterns of energy and fluid balance. These signals are subtle, easily normalized, and frequently mistaken for other issues. One of the most common, yet overlooked, signs is a persistent change in urinary habits. This might manifest as needing to wake up multiple times during the night to urinate. While this is often dismissed as a normal part of aging or drinking too much fluid before bed, it can be a significant clue. The mechanism behind this nighttime urination, known as nocturia, relates to the kidney's concentrating ability. Healthy kidneys work hard during the day and slow down at night, concentrating urine so that sleep is not interrupted. When their function declines, they lose this ability to concentrate waste effectively. The kidneys must then work overtime, producing more urine volume to excrete the same amount of metabolic waste, a task that continues into the night. From a perspective of Heng, the true failure is not the change itself, but the failure to notice the pattern. Awareness of the frequency, color, and urgency of hydration needs provides essential data. A person might observe that their urine appears consistently pale, even when fluid intake is not excessive, indicating the kidneys are flushing water rather than concentrating waste. Conversely, urine might become chronically dark or foamy, suggesting protein leakage or dehydration as the filters struggle. Another subtle signal is a pervasive fatigue that is disproportionate to activity levels. This is not the simple tiredness from a long day, but a deep cellular exhaustion. This often links back to the kidney's role in hormone production. As renal function declines, the kidneys produce less erythropoietin, the hormone signaling red blood cell production. The resulting drop in red blood cells, or anemia, starves the body's tissues of oxygen, leading to chronic fatigue, weakness, and even cognitive fog or dizziness. An applied scenario might involve an individual who used to be active but now finds themselves needing a nap every afternoon. They might struggle with motivation for activities they once enjoyed. They assume they're simply getting older or perhaps depressed. They may try to compensate with more caffeine, which can act as a diuretic and further stress the kidneys, creating a difficult cycle. This energy depletion is a direct physiological signal that the body's core battery is running low. However, these signs are not definitive proof of kidney issues on their own. This presents a clear limitation in self-assessment. Fatigue is one of the most common complaints in medicine and can be caused by hundreds of factors, including stress, poor sleep, thyroid issues, or depression. Similarly, changes in urination can be caused by prostate issues in men, bladder infections, or simple overhydration. It is the persistence of the pattern, rather than a single event, that matters. The challenge lies in separating the signal from the noise. A person might drink a large amount of water and experience temporary urinary frequency, which is a normal physiological response. But the person whose kidneys are struggling experiences this frequency without the corresponding excessive intake. This distinction is crucial. The integration of mindfulness, as emphasized in Heng's philosophy, is essential here. It is the practice of non-judgmental observation of these daily rhythms. It means asking, not just once, but consistently, is this pattern new? Is it persistent? Does my energy match my activity? Or is there a disconnect? This observational data is invaluable for long-term health. A counterexample to this pattern-based approach is the individual who obsesses over every small fluctuation. Health anxiety can lead a person to misinterpret normal bodily functions as signs of disease. The goal is not to foster paranoia, but to cultivate calm, consistent awareness. It is the difference between anxiously checking for problems and mindfully checking in with the body. While these signs are subtle, the body has louder methods of communication when these are ignored. The body does not want to be sick. It wants to be in balance, and it will use every tool it has to signal that the balance is threatened. Where do I trade comfort for approval today? The body's cry. When swelling and discomfort appear, when the subtle signals of imbalance are missed, the body must escalate its communication. Physical discomfort and visible swelling, or edema, are much more difficult to ignore. These signs indicate that the kidney's capacity to manage fluids and filter waste is becoming significantly overwhelmed. The most common areas for this swelling are the feet, ankles, and lower legs, as gravity pulls the excess fluid downward. It might also appear as puffiness around the eyes, especially in the morning. The mechanism behind this edema is a breakdown in the kidney's primary function, fluid and sodium regulation. Healthy kidneys meticulously decide how much water and salt to retain and how much to excrete. When kidney function declines, they struggle to filter sodium effectively. Where sodium goes, water follows. The body begins to retain this excess fluid in the interstitial spaces, the areas between the cells, leading to visible swelling. This swelling is often dismissed at first. An individual might notice their socks leaving deep indentations on their ankles at the end of the day. They might find their shoes feel unusually tight. If the swelling is in the hands, they might struggle to remove rings that were once loose. This puffiness is a physical sign that the body's drainage system is backing up. The fluid that should have been processed and removed is now stagnating in the tissues. Heng Yi's approach suggests viewing this not as an isolated symptom, but as a critical breakdown in the body's fluid intelligence. The swelling is a physical manifestation of stagnation. The kidneys, unable to regulate the flow, are forcing the body to store water in tissues, a sign that the fundamental balance of intake, processing, and output is compromised. This perspective demands an inquiry into the entire system, not just the swollen ankle. Another, more alarming, signal is persistent discomfort or pain. While the kidneys themselves are often silent, pain in the lower back, just below the rib cage, or on the sides can be related to them. This is distinct from muscular back pain, which is more common. Kidney pain is often felt deeper and can sometimes radiate to the groin. This may signal an infection or a kidney stone, but can also indicate inflammation or pressure within the organ itself. A limitation of using swelling as a diagnostic tool is that, like fatigue, it has many potential causes. Edema can be a sign of heart failure, as the heart is not strong enough to pump blood effectively, causing it to pool. It can also result from liver disease, which changes the protein balance in the blood, allowing fluid to leak into tissues. Even standing or sitting for too long, or a high-sodium meal, can cause temporary, minor swelling. However, swelling related to kidney compromise has specific characteristics. It is often pitting, meaning that if a finger is pressed into the swollen area for a few seconds, it leaves an indentation that remains for a moment. This demonstrates that the fluid is truly trapped in the tissue. This is a clear, physical message that the body's fluid dynamics are failing. It is a profound realization when an individual understands their body is not betraying them, but desperately trying to signal an internal imbalance. The body is using the language of pressure, volume, and discomfort to demand attention. The transition from subtle fatigue to visible swelling represents a significant escalation, a sign that the root system is now struggling to hold the entire structure upright. This escalation from silent fatigue to overt swelling or pain marks a critical juncture. The body's whispers have been ignored, and now its cries for help are physical and visible. What boundary would I set if fear were quiet? The mind-body link in renal health, the health of the kidneys, cannot be separated from the health of the mind. Modern life places extraordinary demands on the human stress response system, and this has a direct, physical impact on renal function. The kidneys are intimately linked to the body's management of stress through the adrenal glands, which sit directly on top of them. When the mind perceives chronic stress, anxiety, or fear, it triggers a cascade of hormones that directly affect the kidneys. The primary mechanism involves hormones like cortisol and adrenaline. These fight or flight chemicals prepare the body for perceived danger. They increase heart rate, shunt blood to the muscles, and critically, raise blood pressure. While this response is useful for acute, short-term dangers, modern stress is often chronic and psychological. This means the body is kept in a state of high alert and blood pressure remains elevated. This chronic high blood pressure is devastating to the kidneys. The kidneys are essentially a massive network of tiny, delicate blood vessels, the glomeruli, which perform the filtration. High pressure constantly slams against these delicate structures, causing scarring and damage over time. This reduces their filtering ability, forcing the remaining functional units to work harder, which in turn raises blood pressure further. It becomes a destructive cycle, initiated and sustained by chronic mental and emotional stress. This aligns with the unified view of health often emphasized by Heng. The mind is not separate from the organs. Chronic mental tension creates a corresponding physical tension. A state of constant activation, or anxiety, places a direct and measurable load on the kidneys by constricting blood flow and elevating pressure. The body does not differentiate between a physical threat and the psychological threat of a deadline or financial worry. The hormonal response is the same. An applied scenario is the high-performing executive who thrives on stress. This individual may sleep only a few hours, rely heavily on caffeine, and navigate constant high-stakes decisions. They may feel wired and productive, but internally, their body is in a state of siege. Their chronically high cortisol levels may lead to poor food choices, disrupted sleep, and elevated blood sugar, all of which are independent risk factors for kidney damage. The stress they perceive as a motivator is simultaneously eroding their body's most vital filtering system. This concept finds a parallel in traditional views of health, which often link the kidneys to the emotion of fear. A state of chronic fear or anxiety, from this perspective, depletes the foundational energy stored by the kidneys. While modern physiology uses the language of hormones and blood pressure, the observational result is the same. Chronic stress exhausts the renal system and depletes vitality. Of course, a significant limitation exists in this view. Stress is not the only cause of kidney decline. Genetic predispositions, infections, autoimmune diseases, and physical toxins play enormous roles. An individual cannot simply meditate their way out of a genetic kidney disorder. Blaming the patient's mindset for a complex physiological disease is both inaccurate and unhelpful. The counterexample is the individual who lives a very calm, low-stress life, but has a poor diet high in processed foods, sugar, and sodium. This diet creates a different kind of internal stress, metabolic stress. This, combined with sedentary behavior, leads to obesity and type 2 diabetes, which are the two leading causes of kidney failure, regardless of the person's emotional state. Therefore, the mind-body connection is not an exclusive cause, but an accelerant and a critical component of a larger picture. Heng Yi's philosophy would suggest that managing the mind is as much a part of physical health as managing diet. It is about reducing the total load on the system. This includes the load of emotional stress, the load of metabolic waste from poor food, and the load of environmental toxins. If the mind and body are so linked, then the path to preservation must also be holistic. It is not enough to treat the blood pressure without asking what is causing the pressure. It requires a deep look at the habits of mind, not just the habits of the body, to truly support the deep, silent work of the kidneys. What stress am I holding on to that my body must process? Proactive paths to kidney preservation, understanding the quiet work of the kidneys and the subtle ways they signal distress, leads to a crucial conclusion. Preservation is a matter of proactive, daily practice. The framework for preserving vitality, as seen through the lens of Heng, is therefore not a complex medical protocol, but a return to fundamental awareness. It is the practice of noticing. It involves observing the subtle relationship between intake, food, drink, stress, and output, energy, waste, emotion. The final topic is not about a cure, but about prevention and management. The foundation of this preservation path is managing the body's internal environment to reduce the kidney's workload. The most powerful mechanisms for this are threefold: regulating blood pressure, controlling blood sugar, and managing fluid and nutrient intake. These actions directly address the greatest threats to long-term kidney health. An applied scenario for preservation is the mindful meal. This goes beyond just what is eaten. An individual practicing this might consciously choose whole, unprocessed foods, recognizing that every ingredient must be processed by their liver and kidneys. They will be mindful of sodium, not by eliminating it, but by avoiding the massive doses hidden in packaged foods and restaurant meals. This simple act of awareness directly lowers blood pressure and reduces the filtration burden. This same mindfulness applies to hydration. It is not about forcing down gallons of water, but about listening to the body's thirst and observing the color of its urine. It is about providing the kidneys with adequate fluid to do their job without overwhelming them. This approach, reflecting the balance sought by Heng, is about moderation and attunement, not extreme measures. The proactive path also integrates the mind-body connection. Recognizing that stress directly translates to kidney load, the practice must include mechanisms for down-regulating the nervous system. This might be formal meditation, time in nature, deep breathing, or martial practice. These are not luxuries. They are essential maintenance for a high-pressure world. They are practical tools for lowering cortisol and, by extension, protecting the delicate filters of the kidneys. A significant limitation of this proactive approach is that it cannot reverse significant damage that has already occurred. Kidney tissue, once scarred, generally does not regenerate. This reality makes prevention all the more critical. The goal is not to regain lost function, but to preserve every bit of function that remains, slowing or halting the progression of decline. This is a message of stewardship, not miraculous recovery. A counterexample would be the person who, upon learning of mild kidney impairment, adopts an extreme and unsustainable diet. They might, for example, incorrectly restrict all protein, becoming malnourished, or drink toxic levels of water. Preservation is not about panic. It is about sustainable, intelligent, and consistent adjustment. The path of awareness is long and steady. Ultimately, the journey to kidney health resolves the initial promise of mastering vitality. It is mastered not by conquering the body, but by listening to it. The warning signs are not failures, but invitations to observe and adjust. By managing the loads of stress, sugar, and salt, and by cultivating a quiet awareness of the body's subtle shifts, an individual can honor the silent, life-sustaining work of these vital organs. The kidneys sustain the root of vitality, and like any deep root, they thrive not on aggressive intervention, but on consistent, mindful care. What small, consistent action can I take for my health?